Hello everyone, my name is Victor Diaz. Today I'm going to talk about high blood pressure. Well, what is high blood pressure? It is a disease that affects the arteries of the body, and it is caused by an increase in the force of the blood passing through the arteries. And this problem can damage the walls of the arteries, clogging or breaking them. And there are two components of blood pressure: systolic pressure and diastolic pressure. The systolic pressure is when the ventricles pump blood to the organs, and the diastolic pressure is when the heart is filling with blood. And this is a classification of the blood pressure levels.
Talking about etiology, there is no specific case, but there are some factors that cause high blood pressure, such as age, family history, obesity, not exercise, consume alcohol or cigarette, and eat a lot of sodium.
In pathophysiology, arterial hypertension is basically characterized by the existence of endothelial dysfunction, with a breakdown of the balance between the relaxing factors to the blood vessel and the constructive factors.
Now we're going to talk about epidemiology. In Mexico, there is one of the main chronic diseases that exists. More than 30 million people have high blood pressure. One person in four has the condition. The information according to the INEGI of 2020 mentions that 24.9% of men and 26.1% of women have the disease. It is the case of 50,000 deaths per year.
In symptoms, most people with high blood pressure have no symptoms. You can have hypertension for years without having any symptoms. But some people with high blood pressure may have these symptoms: headache, shortness of breath, and nosebleeds.
Let's talk about clinical manifestations. Some of the complications of hypertension are as follows: heart attack or stroke, heart failure, kidney problems, eye problems, change in memory or comprehension, dementia, and metabolic syndrome. This consists of the irregular breakdown of sugar.
In diagnosis, high blood pressure is usually diagnosed at a medical checkup. Sometimes it is discovered when complications such as a heart failure, a kidney failure, or a brain damage develop. It begins with a complete medical history, physical examination, and laboratory study. You can visit a cardiologist for more security, and it is a best option.
Okay, now pay attention with this. Talking about treatment, initially, the patient's lifestyles must be changed. These measures should be exhausted before starting drug treatment. The general measures are the following: maintain an adequate weight according to the patient's height, maintain moderate physical activity, prescribe a diet low in saturated fat and abundant in fruit, vegetables, fish, and olive oil to maintain LDL cholesterol levels. Avoid drinking alcohol, and the last one is prescribe a salt-free diet for 2 weeks, and if the blood pressure figures do not decrease, continue with a low salt diet.
Okay, and if the patient condition is serious, you can have a drug treatment. But what are the drugs indicated for the treatment of hypertension? One is diuretics, two is beta blockers, three is a calcium antagonist, four is angiotensin receptor antagonist, and five alpha beta blockers. Is the most indication treatment to the drugs.
Now, with all the information collected in this video, we can now say that hypertension is a condition that must be treated with the importance it deserves, because thanks to it, many people can suffer complications that can lead to death. We as future doctors must be aware of providing a good diagnostic and seeking the ideal treatment for each patient. I really hope you liked this video. Goodbye.